I say it is too early to analyze that are we going towards a pandemic, or it is going to be really a deadly condition for us, or we are going to have severe diseases.
WHO and various global groups, including Indian Institute of Science here in Karnataka, have actually been working on pandemic preparedness very diligently.
So we need to take all the precautions related to respiratory droplet infections. So respiratory etiquettes like wearing mask, practicing social hygiene, social distancing, and hand hygiene is important.
I think the message to the people at this point should be: do not create panic, especially children, schools, parent-teacher associations would, or these SDMC committees would need to be more proactive at this juncture to create more awareness.
This virus as such is not a new virus. The one HMPV that we know is a common cold virus, which was circulating in India also, and it's not a new virus.
As the New Year fever wears down, the world finds itself facing the possibility of a major outbreak. Reports about the spread of HMPV, a human Metapneumovirus in China, have raised alarm worldwide, with many fearing that the rapid transmission of the virus may lead to a COVID-19-like pandemic or a similar health emergency. Social media is replete with images and videos of patients crowding Chinese hospitals with a COVID-19-like infection. How dire is the situation? What are the symptoms? And how worried should you and I be? Especially since 4 cases have already been identified in the country. Also, what precautions can be taken? To talk about all that, I'm joined by Dr. Ankita Baidya, Infectious Disease Specialist, Manipal Hospital, Delhi. And we're also joined by Dr. Vishal Rao Dean, Healthcare Global Cancer Center, and Chairman of Posspole One Health Mission. Dr. Rao, let me start with you. If you can tell us about, what do we know about the virus so far? What do we know about the infection so far? Sorry.
Hi, good evening. I think the most important thing that the audience need to know is this is not a new virus. This was first detected, I think, way back in 2001 in Netherlands, and the first report from India came from Pune in 2004. And I was looking at some of the data from India, and JIPMER had actually come out with some very interesting Indian data, which I think is very relevant for the discussion today. When they did a sample collection of about 500 odd people way back in 2011 odd period, they found a 5% prevalence at that time. Now I'm just trying to raise a point here to say, look, this has been there for more than 25 years in India. We are creating a premature panic at this point in time. I wouldn't want to actually jump the gun and say that this is a China kind of a scenario, or this is a scenario of a repeat COVID pandemic. I wouldn't want to create such a kind of alarm at this juncture. People need to know that this has been there for too long. Children, in fact, the Pondicherry study by JIPMER showed that adults were also infected, in fact more compared to children in their study, which they were not able to correlate with the North Indian data. But nonetheless, what I'm trying to re-emphasize here is, I think there's a lot known about this virus compared to COVID, where nothing much was known.
Right. Dr. Baidya, do you agree with Dr. Rao's assessment?
Yeah, definitely, Abhishek. So as Dr. Rao rightly mentioned, that this virus as such is not a new virus. The one HMPV that we know is a common cold virus, which was circulating in India also, and it's not a new virus for us. Now the concern here is that the outbreak that China is talking about, that we are seeing all the photos and images that are available right now in different platforms. These images are concerning in the sense that why there is such a rapid outbreak in a certain zone of that country. Is there any strain variation there? So we need to analyze that closely, because what we had seen with the COVID-19, that coronaviruses do exist with us earlier also. It was again not a new virus, but the difference in the COVID-19 strain was there, that it was able to cause a lot of severe disease compared to what the coronaviruses we earlier know, that it was again a common cold virus. So this strain change, if at all any mutations are there, has to be closely watched, and that is why there is a global alert. WHO is also talking about this, and Indian government is also talking about this. We want best we can do so that we don't land up into that situation. I say it is too early to analyze that are we going towards a pandemic, or it is going to be really a deadly condition for us, or we are going to have severe diseases. right now, whatever cases has been reported is in the children. And this is a known fact for HMPV that it affects more commonly children. I can say around 60 to 65% of the cases which are reported by HMPV infection in different studies, whatever has been conducted, is mainly seen in young children less than 5 years of age. So that data still holds, and when we are looking for the virus actively, we are getting the virus. So most likely, most of the time, HMPV, if somebody gets, the person recovers through his own immunity within a week. Like 7 days, there is a good recovery if the immunity is otherwise good. This holds less common with the children where we are actually concerned, less than 5 years, less than 2 years of infants, where actually if the HPV infection is there, it can cause bronchiolitis, it can cause pneumonia, and that's a concerning situation. Also in elderly or people with respiratory problem like asthma, COPD, if at all it is already there, then there is a problem and might be a problem. So that is why the alert and the concerns are there, and why we are talking about this virus, so that better precautionary steps are taken on time, and then we don't land up into that COVID-19 situation again.
Doctor, could it be fatal? I mean, considering you were talking about the fact that the immunity of a human is capable of dealing with this virus in about a week's time, as you were saying earlier. But when it comes to children and elderly, do you think their immune systems can also deal with this? And if not, could this be fatal in such cases?
Yes, so what I have mentioned, that around 60 to 65% are seen in children and around 8 to 10% are seen in elderly. So it is not like that all these patients who are suffering from HLPV are going to get hospitalization. There is only few numbers in them which requires hospitalization, oxygen support, or develop bronchiolitis or pneumonia. So it is right now that fear factor, that panic should not be there. But yes, we cannot leave it like this, thinking that it was a normal virus earlier also present with us, and looking in the news that what is happening in our neighbor country, we have to be in alert to understand this virus situation in our country. If at all this strain is the earlier circulating strain, that is what is being detected right now. 4 cases that has been detected. I say it is a dynamic number. Maybe we are testing more, we will get more numbers also, as this virus was already there. So if the strain is same as the China, then that will be a concern, might be a concern, may not be a concern. We are having different population, but yes, close watch is required in that.
Right. Dr. Rao, these cases have been identified in 3 different states. One is in Gujarat, 2 in Karnataka, and 1 in West Bengal. As you were saying, this is not a new virus. So what could be the reason behind the outbreak now? Or is it too early to comment on that?
I wouldn't call it an outbreak at all right now.
Okay.
Because that would change the entire connotation of this discussion. I think Government of India, ICMR, state government, health ministries in Karnataka also have made it very clear that this is currently not an outbreak, but the first initial detection. But I would like to reiterate that go back to 2011, and I'm telling you the data from there speaks that random sampling of the nose, like how we would detect in COVID, would actually give us a 5% yield in a general population when you do it. Okay. Now this is very important to understand that, like Dr. Baidya very rightly put, the more you test, the more you're going to pick this up. So that's not supposed to create panic. Already we are seeing a lot of panic in the markets, in everywhere, with a kind of a wrong messaging, which I think may not be something that we should react at this point in time calling it an outbreak. But I would fully agree that preparedness is paramount, and WHO and various global groups, including Indian Institute of Science here in Karnataka, have actually been working on pandemic preparedness very diligently. They've already mapped out the list of pathogens, they're working on the kits, they've been looking at the entire spectrum of these viruses, beyond viruses also, to understand which of them are potentially going to be future pandemics. So the preparedness level compared to what we were in 2019-20 is different right now, and I think India is at a much better poised state with its technology, with RT-PCR or with its beds, oxygen. We are at a much better state. So I wouldn't again panic at all at this point in time. I would reassure people to say, do not hit the panic button. Do not fall for WhatsApp University forwards and start self-medicating yourself at this juncture. It's too early. It's not an outbreak.
Right. Multiple key points there. But I think, when you were talking about the panic among the people, I think one of the key factors there is the fact that, once bitten, twice shy. So people have seen the kind of mayhem that COVID caused, and 5 years later, we are talking about another virus. Thankfully, this time, as both of you have said, we know, about this virus. We know, how it operates, and the people it affects, in particular, the elderly and the children. You were talking about preparedness, Dr. Rao. If you could talk to us a little bit about that at this point in time. What is the kind of preparedness that we have to deal with such a situation? Because you were also, if I'm not wrong, you were also on the COVID preparedness task force of Karnataka.
So, as a part of the Genomic Surveillance Committee in Karnataka, which is one of the earliest set up committees to actually deal with genomic surveillance, Karnataka had done one of the largest number of sequencing. And that was a very important learning for us, that at a time when, health is a state subject and every state will have to be vigilant and be ready. And genomic surveillance is a technology which we should actively use at this juncture. Especially, I would again like to highlight what Dr. Vaidya said, that this is an RNA virus, it will mutate. So it's important for us to keep mapping the genomic pattern of, is it kind of mutating in certain pathways by which it can be harmful to us. And now that's something that the medical fraternity will have to do with the government actively to prepare. And the best examples today we have from pandemic preparedness is the 717 protocol by the Resolve for Save Life with the WHO partners who are implementing it globally. And we've been a part of a lot of these discussions. It's very interesting to look at how pandemic preparedness with the 717 protocol could be very useful. That is 7 days to detect, 1 day to inform, and 7 more days to initiate an action. So that's something like that is what already India is in the line of preparation. And I'm sure that now it's for every state to kind of make its own level of preparation. And I think one important lesson from this entire HMPV alarm is that every state needs to understand that pandemic preparedness centers, One Health Mission, is something which Government of India has been talking about for now 2 years. Every state government should become serious about setting up a pandemic preparedness center which should actively work on predicting and preparing pandemics.
Right. Dr. Baidya, can you talk to us for a little while about the established treatment protocol for those affected by this virus?
So right now, if there is no dedicated antivirus and no antibiotics are going to work on this virus as such, so that we need to remember. Self-medication is not at all recommended. Anybody having flu-like symptoms, these are the common symptoms that we see with HMPV also, like fever, sore throat, running nose, cough, headache. So these symptoms can be there as a part of HMPV infection, and just like flu-like symptoms are there. So whatever symptoms are there, we give supportive care for that. So like somebody is having fever, you require antipyretics. Stay hydrated for recovering from any viral illness, and take good nutrition that time whenever the viral illness is there. So these are the key factors that we need to remember. No antivirals, no antibiotics, just the supportive treatment after consultation with your doctor. Supposedly there is some degree of lung involvement that we assess during like examination of the patient, like bronchiolitis is there, or some different sound is there when we auscultate the patient. Accordingly, we advise the patient that you need to take certain nebulizer or certain medication, but it should not be universal. So no message for any universal medication that somebody can self-medicate. But yes, after showing to your doctor, if based on the symptoms and supportive care, the symptomatic treatment is being provided.
Right. Dr. Rao, what would you say about some of the precautions that people can take? Would you advise the usage of masks or anything else for that matter?
So this is just a revision what we have learned in COVID-19, and such that it's again a respiratory virus. So we need to take all the precautions related to respiratory droplet infection. So respiratory etiquettes like wearing mask, practicing social hygiene, social distancing, and hand hygiene is important. Like this virus can also spread through coughing, sneezing while talking also. So if somebody having any flu-like symptoms, it is very important that that person at least should be wearing mask. This decreases the chance of transmission to around 90 to 95%. And if this person who is sitting next to the person who is infected is also wearing mask, this further increases the protection rate. So somebody infected having any viral-like symptoms, please do wear mask. I insist as a infectious disease physician to you all. And if possible, if somebody is people are going to crowded places, wearing mask is always advised
Right.
whenever
And
such
Dr.
virus
Rao,
is in
right,
circulation.
right. Dr. Rao, in cases where this infection is identified, is isolation also recommended to patients?
No, no, not as of now. Absolutely not as of now. And
Okay.
again, I would say the main symptoms are sore throat, fever, cough. These are three things that are going to be present. Now, we also need to know that a lot of the people in this season are going to go through flu. They're going to go through regular cold and cough because of other viruses. And so, putting everything as HMPV would be a completely wrong approach at this juncture. And like Dr. Vaidya said, I think again I would like to reiterate one more point is ventilation. Ventilate your offices, rooms well, because that's the most important thing. And the key differentiator here between COVID versus this virus is that COVID also was rapidly moving through breath and speech kind of a thing because of air. But this is a clear droplet infection. So we don't have to create, there's a clear demarcation of difference between the way COVID would move at the rapidity and transmission compared to what the HMPV is doing. So that's something that we would need to understand from the audience so that they don't queue up in hospitals, especially when it involves children and below 5, like Dr. Vaidya said. There is going to be a sense of panic among the parents to rush, and I think that's where we need to actually exert a lot of caution. She earlier also spoke about pneumonia, bronchitis. Unless you're seeing something like that, which is again very small percentage, most of them are self-limiting. I think the message to the people at this point should be do not create panic, especially children, schools, parent-teacher associations would, or these SDMC committees would need to be more proactive at this juncture to create more awareness rather than create panic and kind of send wrong messages.
Right. And both of you briefly spoke about the possibility of mutation of this virus. The virus, as both of you mentioned, has been known since the early 2000s. But what are the chances, the possibility of the virus actually mutating? This question is for both of you. I guess we will start with Dr. Baidya.
Okay. So being an RNA virus, there are certain checkpoints which are being missing in such kind of viruses, and they tend to mutate very, very quickly. So, but these mutations are whether clinically relevant to us or not. So if any mutation is there, what kind of changes it has brought to the virus, that it is going to cause more of pneumonia, more of severe disease, that is what is the concern as a clinician we have. So right now, yes, RNA viruses do mutate faster than as compared to DNA viruses, if I say. And as this HMPV is also RNA virus, there are chances of mutation, but these mutations actually are clinically relevant or not. Is this going to cause any changes in the viral structure leading to a bad disease? That is what is concerning as a physician that we have as such.
Right. Dr. Rao, would you like to add anything to that?
I think I would fully agree on this to say that at this juncture, the genomic surveillance and globally, the GISAID is the platform that's actually monitoring this entire thing where global data is being fed from every country, every institution. It's very important that we map this thing to understand the RNA virus and the way it's changing its genomic thing. But again, not to generalize this to say that every single mutation, because we know with COVID that every single time it was mutating so rapidly, not every single variant was lethal. So we need to take that cue and understand that yes, variations and mutations are going to happen in these viruses. That is well known. Again, this has been an old virus, not a new one. Till now, there has been no official report of a new strain or a subtype of this virus reported either from China or from any other part of the world at this juncture. And that's something that is not official. So till this time, I don't think we should speculate to say that the virus has mutated until we get an official report from GISAID, WHO, or any other authentic organization or institution telling us that they have found a mutation. Till then, I think this is another HMPV old virus which has been there for too long.
Right. And my last question to both of you, although it seldom happens that any information percolates through the Chinese information wall, but do we know anything about the outbreak in China and why it happened at this point in time or not?
So we know
We can
when
start
there's
with you, Dr. Baidya.
So we know winters are the favorable time for these viruses to come up and show their activity, and we see a lot of cases of viral infections in winters. So this is a known fact. If I talk about China, because of certain habits there and close proximity with the animals as such, we have seen in past also a lot of new strains of viruses coming up from China, and this was seen in the past also, just like similar to COVID-19 virus as we know. So as such, this part, if I say viral infections are common at this time of the year, and we should not be panicking about that this outbreak is there. There could be certain host factor, geographical factor, which has led to this condition right now in China. And as mentioned, the world is looking upon it. And close watch is being there, so to understand better, like what is the genetic variation of the virus, for better understanding whether it is going to cause any clinical severity in other parts of the world also.
Right. Dr. Rao?
I'll just add one point that, earlier also our worry was that China was too tight-lipped about it for the first crucial 3 months, which is where the world actually felt that a lot could have been done. Now, at this juncture, let me tell you that when Omicron came also, there were photos from China of people lining up saying that this is another virus, it's going to affect children. There was panic, there were committees created of pediatricians, and I'm still in touch with my pediatric colleagues. The point is, I think it's a little too premature at this juncture, and we wouldn't want to speculate on any such images and start until an official correspondence comes from China, which I think has taken much more responsibility after the COVID pandemic to the global podium at WHO to say that they are going to be taking things more responsibly. And I would like to believe that they are going to be more responsible this time to talk to us, talk to the globe about what actually is happening there, which would reassure us rather than creating a global panic or disturbing the entire workflow or businesses at this moment.
Right. Dr. Rao, Dr. Baidya, thank you so much for taking the time to talk to us and, of course, shed some light on, what's happening as far as HMPV is concerned. Thank you.